Hey guys, so we're going to talk about the peak flow meter. We've already kind of talked about it in lab already about how to calculate your green, yellow, and red zones, but I'll briefly talk about that. Inside of your peak flow, when you open it up for the first time, it'll come apart like so. You just take your mouthpiece part, attach it to your peak flow, and you're ready to go. So as you can see here, you have a green, a yellow, and a red zone. When we get ready to calculate your green, yellow, red zones based on your personal best, which is obviously based on your height and your age, we'll put these here, and this will be a good guide to go by whether or not the patient's in distress and how to treat the patient based on whatever zone they're in. This little blue ball or blue piece needs to be down at the bottom, the base of the peak flow at all times when not in use to ensure that we get adequate flow.
Measurements,
sure.
Yeah, those things.
So open up your packaging and you'll have a little normogram or a chart right here. They have it for men, women, and children. You'll have to estimate your age and your height if you fall between these ranges. So, for example, I'm 35 and I'm 5'6", so I'm going to use 35 and 65 inches, which is 5'5", and that's about 442 will be my personal best. So on here, I'm going to find 442 roughly, put that here. That's the top of my personal best. Then I'm going to take 442 and times it by 0.8, and that's going to give me the end of my green zone, the beginning of my yellow zone, and I'll adjust that there. And then I'm going to take that same 442 or whatever number you get from your chart, and I'm going to times that by 0.5, and that's going to give me the end of my yellow zone and the beginning of my red zone. Anything below the red zone, obviously you're not doing well and you need to go to the hospital. So you'll set this up. Patients usually get this when they're getting ready to go home, or if they're outpatient and they're being educated on how to monitor their asthma at home and whether or not they need to come to a doctor and stuff like that. So the best way to do this is have them sit up nice and tall, take a nice deep breath in, and they're going to blow hard and fast, okay? So we're going to do it one time for right now. So you're going to go big deep breath in and blow. As you can see, right now, I'm good. So we're going to do a series of 3 of these. Take the best out of the 3, then you'll give them a breathing treatment, and then you'll repeat this again times 3 and get their personal best at the end, and then you'll document both. Dr. Moore already talked to you guys about the change in percent to let us know if the nebulizer is actually working or the medication is adequate for the patient, and you're seeing a 15% change. And if you're not, then sometimes we'll consult the doctors and we'll prescribe them something else and see if that will help them. That's how you use a peak flow.